one. Hi, this is John Bennett of Neurosurgical TV. It gives me great honor to be televising Juan Valdivia, a spine surgeon from Tampa. He's going to take us through what he's doing, but let me have Stephanie introduce him formally. Welcome, Stephanie.
Thank you, Dr. Bennett. I'm Nicole Fuentes. I'm a medical student from Bolivia, part of the student team in charge of Dr. John Bennett of Neurosurgical TV platform. I'm glad to be here and have the honor to introduce the great Dr. Juan Valdivia. He had done his medical degree on Cayetano University, Peruvian, and he had his neurosurgery degree in the University of Arizona. He's actually a spine surgeon and is doing volunteer work, and he will be showing us a little bit of Haiti. Thank you, Doctor.
Hey, thank you. So we're doing this neurosurgery neurology clinic here in Lagunaf and the island of Lagunaf of Haiti. And I'm going to show you a little quick tool to examine a baby with possibly a congenital abnormality of the brain. And then I'm going to handle
Just be patient with the bandwidth.
The team that is in charge of this clinic and in charge of this nonprofit is going to need your help. The neurosurgical community in the world. We need if I can swap this. Yeah, just a kid. Doing the ultrasound. And here you see a coronal view of the brain. It's live. I think it's a great tool to do neurosurgery clinic and neurology in areas where you don't have a CT scan or an MRI. The island of Lagunaf does not have an MRI or a CT scan, and we need it. So I think this is a great tool to not only see and diagnose hydrocephalus, but also general and gross anatomy of the brain, defects and malformations, Chiari malformations. This is a coronal cut of a live view of the brain. You can see the ventricular system, sulci, subarachnoid space, and posterior fossa. And I'm going to show you the sagittal view now. And in the sagittal view, you see corpus callosum, lateral ventricle, brainstem, etc. So this is a great tool, and we're trying to do a good job here for the community. We're going to show you patients later as they come in. And now I'd like to introduce you to the team quickly, and I'm going to hand off the phone to Sam. Go ahead, Sam.
Hey, nice to meet you and see Dr. Juan here. And that's a pleasure to have you here in our clinic, as we are the person that working with For You Haiti, the nonprofit of Lagunaf. We help the vulnerable kids and the kids that really need surgery. And we really need your help here, because the people here is just living by themselves, waiting for mainland and to help. So by having Dr. Juan here, that's a blessing that we hope more blessing coming. And also we have the founder of For You Haiti, Alana Kai. She's a great angel that God sent to us. And we really believe together we can do more if you come down and help more. We love you.
All right. Here's the boss. Here's the founder.
Hey, it's so nice to meet you all. So I'm from Australia. I'm the founder of For You Haiti here. And we have a clinic and medical program that takes children from the remote island of Lagunaf to Port-au-Prince, to the hospitals to have surgery, or to the US and Europe if the specialists aren't able to come here to Port-au-Prince. So we have been operating here for 5 years, and we've done just over 500 surgeries. But as Dr. Valdivia said, we don't have a CT scan or anything here on the island. The only way that the island can be reached is by boat. So we definitely need your help, and we're so excited that you're all watching today. This is the very first neuro clinic we've ever done in Lagunaf, and there's 130,000 people here on the island. Yeah, no roads were ever built. There's no running water, no electricity. So very basic out here. And this is our amazing full-time doctor, Dr. Junior.
Hi, I'm Dr. Junior. It's always a pleasure for us to have Dr. Juan with us. He's the very first neurologic surgeon here at Lagunav. Because whenever we need to see a neurosurgeon, we have to send them to the mainland, and it's not easy to send them, especially with everything that is happening in the country right now. So our kid is struggling for help. So Dr. Juan is here with our founder Alana and our president Samuel. So we are doing a very deal to help us more. We need you to support us more so we could do more here in the ground. Thank you so much.
Yes.
Go ahead.
We'd also like to introduce you to Joni Pierre, who works with all of our families having surgery. He interprets along with travels with them and coordinates everything from start to finish. So he's also from Lagunav. And then we have Dr. Burley, who is our full-time pediatrician. And yes,
Perfect.
You see Dr. Burley there. So that's the team. We have a really small clinic here, but we serve about 2,000 patients per year. So thank you all so much. I'll put it back onto Dr. Valdivia now.
Thank you, John. Let me show you a little bit of outside. So we're doing clinic today. We saw 8 hydrocephalus patients yesterday. It's difficult to do a clinic here because you think about putting shunts on patients with hydrocephalus, but this patient live in the country and they don't have MRI. Now these patients don't have a high risk of shunt erosion. Some function. So very challenging one with ATV. So that's why we reach back and see if you're. Thank you, John.
Okay, very good. I'm sorry to say that we were challenged by the bandwidth a little bit, Juan. I think we got an appreciation of what you're doing and what the team is doing there. We got to work on the bandwidth when we do more.
Sorry.
Because it's okay.
Right.
We got most of it. Does anybody have any?
Thank you.
Anybody have any comments they want to make to Juan?
We'll use you because of your phone.
I'll just give it.
Yeah, is there any way to get better bandwidth, Juan? Is that possible or impossible?
I'm using someone else's phone locally because there's no good connection. There's definitely no Wi-Fi here.
Right.
Remote.
Okay. Well, I think we got the majority. What do you think, Stephanie?
Thank you, doctor. It was great to hear and meet everybody there, and you're doing such a wonderful job. You're inspiring all of the other neurosurgeons and also their students for your wonderful and so wonderful job. Thank you, doctor. You're doing great and hope you them in the very way.
Thanks, Stephanie. Harshad, did you get to see most of that? Harshad?
Yes, John. Excellent work John is doing. He is doing a wonderful job. It's very, very difficult to work in such a remote area where there is not even Wi-Fi available. And great service to the community. And I'm sure this clinic will be benefited to a lot of children, and a lot of hydrocephalus cases will be picked up. And I'm sure, hi John, this is Dr. Harshad Parekh. You remember me?
Yeah, Harshad, correct. And there's Victor. Victor, say hello, Victor.
Hello, how are you, John?
Hey.
How are you, Harshad? Juan Valdivia, nice to see you here. Takashi Kon, all of you, good morning.
Good morning. Takashi, you want to say hello?
Hi, Victor.
Fine. How are you doing?
Good.
Hey, Juan, what's the plan for you today? What are you going to do today?
Well, yeah. So the patients are coming, and it's not doing a clinic in a city because these patients are walking for miles. There's no cars, and they have to come from the mountains. So
as they come in, I may reach out to you, maybe send you some videos so you can update the viewers. I don't
Okay.
think we can, continue being live forever, but let's hope that a patient comes soon. I'll reach out to you. But thank you so much for the time. It's very challenging for these hydrocephalus kids because if you put a shunt on them and they go back to the country miles away by on foot, a shunt malfunction is not uncommon. So these
Right.
kids are very difficult to have a shunt revision. So we're thinking about doing ETVs as an alternative for shunt placement. But I'll keep you posted. And thank you so much for your time.
Yeah. Anytime you want to go online, just let me know. We'll jump back online. And I'm learning how to use Instagram. Instagram's really good with short videos that you send. You can put them right up.
Yes.
So, okay, just keep in touch with us. Let us know what's going on.
Yes, sir. Yes, guys. Thank you. God
Okay,
bless.
we're gonna sign
you.
off, okay?
Thank you,
Thank you.
doctor.
Thank
Bye.
you.
Hey, I'm just gonna hang out here for a second here. Maybe we could use these people to show them the breakout room. Yeah, Juan, if you want to hang around, we're gonna there's a breakout room which is an accessory to the main Zoom. Do you know what I'm saying? Have you ever used the breakout room, Juan?
Yeah.
Yeah, it allows you to not leave the Zoom, but you go into another Zoom part. Okay. And
Yeah.
let me set one up here. See if so like I'll say, okay, Dr. Valdivia is going to be in the breakout room. Let me see where you're at here. I can't even see you. Damn. Oh man. Oh, there you are. Okay, I'm going to assign you to the room. I'm going to assign Victor to the room.
Stephanie.
I'm going to assign
Stephanie.
you. I'm going to assign.
Stephanie.
Okay. Yeah. Hey, Juan, you're in the breakout room now. This is great.
Right.
I really like this because we could say like during the broadcast, okay, the students go in room 1, or Juan wants to talk about what he just gave his presentation on. So it's a lot of possibilities with this.
Very cool. Very cool, man.
Yeah, we gotta keep working on this. Okay.
I'll see you later. Okay. I'm gonna get back
Okay,
back at work.
keep in touch.
Thank you. God bless.
Okay. Okay, I'm gonna
Thank
close.
you,
I'm
sir.
gonna close this room. I'm gonna leave. Oh wow! I tell you, Stephanie, I tell you, it's tough. I'm gonna go off the air now. Okay, I'm gonna stop recording.